In this video, I want to talk just a little bit about some things that you should know about the insurance authorization process. We see a lot of patients at Summit, and we recommend surgery for patients when we think the benefit far outweighs the risk. And generally speaking, we are a surgical practice. We have orthopedic surgery and neurosurgery. It's the core of our practice. We recommend surgery to patients when we really think that surgery is likely to be beneficial. Once we recommend surgery, we want to do the surgery. There's really very little reason why we would recommend surgery to somebody and not want to do the surgery. So we want to be an advocate for you to get your surgery authorized with the insurance. And our desire is to formulate a case for authorization, essentially. Much of this is paperwork. It's dotting I's and crossing T's. It's gathering all of the information and presenting a case to the insurance company. From the insurance company's perspective, they are getting cases brought to them all of the time on surgeons and other providers saying, this patient needs this treatment. What the insurance company does is they compare the notes from the provider against their policy. And it's just a objective comparison. Sometimes they don't get all the records for one reason or another. Sometimes they don't look at all of the records. But what they are tasked with doing is authorizing a procedure or treatment based on their policy that they have formulated, and every insurance company's policies are different, and what coverages the patients have against what information they are provided. So it's our job to give the insurance company as much information as possible in support of doing the surgery. It's your job to help us get that information in the first place. So please fill out the forms and answer the questions that we ask you, and let us know if you did physical therapy and if you've had injections and what medications you've taken and how your problem is affecting your day-to-day life and your activities. And then we take that information to the insurance company. The typical process is about 2 weeks. Now, if it's a patient that needs surgery more urgently, we try to expedite through the process. But we don't have control over all of the hoops that need to be jumped through. And so our authorization team is working full-time trying to get patients' surgeries authorized. We try to stay ahead of time, so several weeks in advance, so that if there are urgent cases or cases that were denied, we have the ability to focus in on those and get them pushed through the system. Please be patient with this process. I think it's frustrating. Patients that are gearing up for surgery are generally in pain and want to get the surgery done. And it's frustrating to hear that a surgery has been denied, for example, or that scheduling needs to be delayed. We really do try to do everything we can to get the surgeries authorized that we have recommended, to work with the insurance company so you're not stuck with a big bill, and so that we can perform the operation, get it paid for, and get you feeling better and get your life back.